Welcome back. I'm Melissa Harris-Perry. Here in Nerdland, we have been watching Pope Francis since the white smoke emerged from the Vatican chimney back in March. And we love him, especially when he gets up close and personal with the people like he did last week. During the Vatican's Year of Faith celebration, a little boy just would not let the Pope be. And he did not seem to mind suffering the little child throughout the event and even seating the boy on his chair while he spoke. And on Wednesday, Pope Francis spotted a man in his audience who was severely disfigured by a rare disease. He went out and laid hands on the man, kissed him, and then prayed with him. This is the kind of embrace that so many of us, Catholic or not, hope to see from the world's religious leaders. But embracing everyone is not something that we're actually used to seeing from the Catholic Church, at least in terms of policy. These symbolic and touching acts illuminate Pope Francis's efforts to open up discourse on doctrine that the Church hasn't been willing to seriously consider changing in, well, pretty much ever. Now, this week, the Pope opened up discourse in an unprecedented way. He is polling Catholics, sending surveys to parishes around the globe, asking questions ranging from what pastoral attention can be given to people who live in these types of, that is, same-sex unions. And in cases where non-practicing Catholics or declared non-believers request the celebration of marriage, describe how this pastoral challenge is dealt with. Also, do the divorced and remarried feel marginalized or suffer from the impossibility of receiving the sacraments? Now, if you're not Catholic or if you're a lapsed Catholic, you may think, what difference does all of this make to me? But it does. It could be a difference of life or death, because the policy of the Pope and of the Church that he leads has a reach that affects all of us. That's because the Catholic Church isn't just a church, could very well be your hospital, too. New information from the ACLU and nonprofit organizations like Merger Watch indicate that while the number of American public and secular nonprofit hospitals dropped dramatically between 2001 and 2011, the number of hospitals affiliated with the Catholic Church shot up 16% during that time. According to Mother Jones, 10 of the 25 largest nonprofit hospital systems in the country are Catholic, and Catholic hospitals care for 1 in 6 patients. Those hospitals get their orders from the United States Conference of Catholic Bishops, a very conservative group now tussling with the Obama White House over the Affordable Care Act and contraception. Those bishops are the men who are setting hospital policy on issues ranging from providing information about available treatments to addressing the tragedies of abnormal pregnancy to dispensing birth control for women, and their reach is growing. Joining me now is Lois Utley, who's director of the Merger Watch Project, which focuses on the issue of Catholic hospital takeovers. Often Brian Stiltner, who's chairperson of the Department of Philosophy, Theology, and Religious Studies at Sacred Heart University in Connecticut. Deborah Stolberg, who is a family physician at the University of Chicago, who previously worked at a non-secular hospital that was taken over by a Catholic one. And Teresa Younger, an activist from Connecticut, who was part of a successful campaign in her community to prevent a hospital merger. So nice to have you all here at the table.
Thank you.
So talk to me a little bit about the Merger Watch, about what we are seeing and why there are more Catholic hospitals now.
Merger Watch has noticed an enormous increase in the number of Catholic hospitals all across the country. Part of it is that Catholic hospitals have organized themselves into giant systems like Ascension Healthcare, which now runs 93 hospitals in 23 states across this country. It has annual revenues of $6 billion, and half of that comes from our public money through Medicare and Medicaid reimbursements. As these hospital systems get bigger and bigger, they take over non-Catholic hospitals, and that's where we're seeing a real problem. We're seeing circumstances like in southeastern Arizona, where a woman suffering a miscarriage went to the emergency room at the local hospital. The doctors there said, "We're really sorry, but you can't, this pregnancy is not going to make it. We should end it now to prevent infection." And then the hospital administrator said, "Oh, no, wait, that's against the Catholic rules." And they sent this poor woman 80 miles away to Tucson for treatment. That's not right.
And, you know, those kinds of stories conflict so fundamentally with the things that I love best about the Catholic Church. And not just about the Catholic Church, but about Catholic hospitals, which have often sort of stood in the gap for the poor, stood in the gap for underserved communities. But then when it comes up against a faith claim, suddenly medical care can't be provided. How do we reconcile something like that?
Well, we do have to admit that it's a possible tension, and I think it's going to be a matter of what message you want to lead with, and what's going to and whether you're going to kind of give the benefit of the doubt. And I think for many years, coming out of the 1960s and the Second Vatican Council, and where the Catholic Church historically has always wanted to put its best foot forward, is that serving the common good, helping those who are most vulnerable, helping the poor, and they would point out at the start of a conversation like this that we do serve so many people through hospitals, social charities, and education, and we should be respected as a player in society in all these ways, and they are. But then the other side of that is we don't want to give up our distinctive beliefs when we kind of go into the public sphere, and that's true, and there has to be a balance struck there. But what I think in kind of the recent years, the bishops, kind of under John Paul and Benedict, have been so concerned about just our religious freedom and the distinctiveness of our institutions that they're always leaning with that foot. And like you, I'm kind of hoping that Pope Francis might say it's this other face of the church that's really got to be our
key face. So talk to me as a doctor on this question. What does it mean to say to someone, I see that you need this medical care. I am capable of providing this medical care for you, but there is an administrator responding to a faith claim which says I cannot provide this medical.
That's exactly right. It's very hard. I experienced it when my hospital where I was working got taken over by a Catholic hospital, and since then I've talked to a lot of doctors who have had a similar experience trying to take the best care of women that they can, that their training tells them to, that the care that women want based on their own values. And as they say, here's the treatment you need, here, we're trying to preserve your health, and then there's an outside force, often someone with no medical training, who says, sorry, not here. And it may mean, as Lois was describing, a patient has to travel. The delay in treatment can actually risk further harm to the woman. Or it may mean she doesn't get the treatment at all. In some cases, doesn't even know it's an option for her.
So this piece is one of the pieces that is most distressing to me, and that is that not even information can often be given. Correct. So it's one thing to say, for example, we're not in this facility going to provide abortions on demand, whatever that means, right? But it's another thing to say, we're not going to tell you that birth control pills exist, and we're not going to tell you that these sets of options exist. As you have sort of tried to work with communities to push back, what are the things that really rile people up when they learn about the Catholic health policies?
Well, I think, many people pick hospitals that are in their communities. They don't even know that they're functioning under these administrative restrictions in any way, shape, or form. But I think what happens, it's not about abortion. At the end of the day, what we saw in Connecticut when we were working on this, it was about tubal ligations. It was about a woman who had 2 children, and she and her partner decided that they no longer wanted to have children, and that they were going to use tubal ligation as a means of birth control, and that the hospital was telling them, you can't have that procedure done here.
Even during a C-section.
Even during a C-section.
Right, so when you've already opened,
you're already there, And so, what it says is that women and their families cannot make the health decisions that they need to make that are best for them and their families. And or it means that a community is going to be without any kind of access to these health services.
And we've been hearing so much in the pushback against ACA, this idea of government being between you and your doctor. And literally, I mean, I really love this Pope. Pope Francis, he's the best, but I don't really want this guy or anybody else between me and the medical decisions that I am making.
And often it's the local bishop, which actually can change. I've talked to a number of doctors who were told when they took a job at a Catholic hospital, your medical judgment and what's best for the patient will be the most important thing, and we will not get in your way. And then a month later, a new bishop is appointed, and they say all the rules have changed, and suddenly every case of impending miscarriage like this, we have to send to the ethics committee. And again, it's a delay in treatment for the woman. No medical reason for this delay. Stay
with us. We're going to be a little bit more on this as we come back. But first, I also want to just sort of point you. We have an issue we have a piece about this issue on our website right now, mhpshow.com. It is a terrific piece by a reporter here, Meredith Clark. When we come back, I want to get more into the issue of how communities are pushing back against these mergers, and if it means that they're going to have to risk having no hospital at all. That's next.